I'm your host, Katinka Blackford Newman, and welcome to the Med-Free Mental Fitness Podcast. In this episode, we're going to be discussing what actually causes depression. Today, I'm joined by renowned psychiatrist, researcher, and author Professor Joanna Moncrieff. In 2022, she was lead author of a landmark scientific study which found no clear evidence that low serotonin causes depression. Both the study and her recent book, Chemically Imbalanced, have caused an enormous stir amongst the medical profession and the general public. I should also say that I have a very special connection with Joanna. I had my own very unfortunate experience with antidepressants in 2012, which had me hospitalized for a year. When I got better by coming off the drugs, I then researched the side effects of antidepressants to write a book, The Pill That Steals Lives. I came across Joanna's work and I was astonished by what she had unearthed. We met up for a coffee and I've followed her work ever since. Joanna, welcome.
Thank you, Katinka. Nice to be here. Nice to see you.
Joanna, I can still remember that conversation back in 2014. What I remember the most is that you said at the time that there is always a reason for people becoming depressed, and that in your own experience, you'd never come across someone who was just struck down with depression for no reason.
In my experience, there is a reason. People have a reason for becoming depressed. They're not necessarily always aware of that reason at the time, but looking back, you can usually trace it to something, some loss, some change, some stress in their lives.
That's echoed in your book, Chemically Imbalanced, where you say that everyone has been depressed at some time or another, and that depression is just a reaction to depressing circumstances.
Our brains and biology are not irrelevant, but we have not found, and in my view are not likely to find, a specific biological process that produces the symptoms of depression. And this is important because before the pharmaceutical industry convinced everyone that depression was due to a chemical imbalance, people understood depression differently. People understood it in the way that I'm describing it, as an emotional reaction to the environment. And so if you asked people what was the cause of depression back in the 1980s or early 1990s, they would tell you it was divorce or unemployment or loneliness or child abuse, not a brain disorder or a chemical imbalance.
You talk in your book about the difference between your experience of depression as a 14-year-old and your younger colleague, Mark Horowitz. So what happened in between?
Dr. Mark Horowitz is a psychiatrist from Australia, and he came over to join my study team in about 2018. And as I got to know him, I found out that he'd been depressed and been treated with many different sorts of medications, including several different sorts of antidepressants, and then various drugs to counteract the various side effects that those antidepressants ended up giving him. And he had ended up finding it very difficult to withdraw from those antidepressants. And so it's taken him a very long time to do that. And it just struck me, hearing his story, that our experiences of depression fell either side of that watershed moment when the pharmaceutical industry come in to promote the SSRIs and really disseminate this idea that depression is due to a chemical imbalance. When I was depressed, the reaction, and my family's reaction, was to try and work out why I was depressed and what we could do about it, what we could change about my circumstances that would help. And when Mark was depressed, I'm sure people did that too, but they also encouraged him to take an antidepressant. That was the culture of the time. That was how things were in the 90s, that he would have been encouraged to have taken an antidepressant. And he ended up setting off on this long trajectory of taking psychiatric medication.
Coming off antidepressants when you get withdrawal is not just a headache or feeling a bit sick for a few weeks. It can be really serious. And we'll come on to that a bit later. But that is the case, isn't it?
Absolutely. It can be a really excruciatingly difficult process for some people that can go on for years. For other people, it can be significant but be over in a few weeks. But for some people, probably people who've been on the medication for longer, it can be a really difficult and prolonged process.
So the other thing you speak about in your book was this Defeat Depression campaign, which you investigate. Can you explain that?
I have vivid memories of this campaign, which started off in about 1992 and ran till about 1997. And it was run by the Royal College of Psychiatrists, and it was a depression awareness campaign. It was partly funded by Eli Lilly, which wasn't widely broadcast at the time, and they contributed about a third to just under a half of the funding. It was a campaign that the materials were produced by the Royal College of Psychiatrists. They told people that depression was an under-recognised illness, that they should see their doctor. They told doctors that they weren't diagnosing enough people, that they were missing people with depression. And they told people that antidepressants were one good way of treating this and that they were not addictive. The overall result was that more and more people went to their doctors with depression and ended up taking antidepressants. So although this campaign was run by the medical profession, it clearly had aims that coincided with those of the pharmaceutical industry.
And so just so that listeners know, Eli Lilly made the antidepressant Prozac and quite a few other antidepressants.
Yes, Prozac was made by Eli Lilly, so that was the main drug available, produced by them when this campaign was being run, but they've since produced other big-selling antidepressants as well.
And I think you say in your book that antidepressants went up by 235% between 1992 and 2002.
Yeah, the increase was staggering, absolutely staggering.
And I remember people just saying it's just like breaking your leg, or it's like being a diabetic or whatever. And it just came to be accepted, didn't it? That this was that depression was an illness and that these drugs were just necessary.
Yes, absolutely. The aim of those campaigns and the advertising campaigns was to normalise the drug treatment of depression, to normalise the idea that depression is a medical condition and that taking drugs for it is a normal thing to do and a sensible thing to do.
You seem to be saying that people are being given a medical treatment for a problem that just isn't medical. And so a lot of people will have thought that there's some kind of blood test or brain scan that you can have for depression. That's just not the case, is it? Can you explain to people, how are people actually diagnosed with depression?
There is nothing that reliably distinguishes the brain of someone who has depression from the brain of someone who doesn't have depression. There is no physical test that you can do to identify depression. So depression is diagnosed on the basis of how people describe that they are feeling. That is the basis on which a diagnosis of depression is made. That term diagnosis is in itself misleading, because a diagnosis implies that you have found the cause of something. Now, when someone is diagnosed with depression, no cause has been found. What has happened is that someone has decided to label what an individual has described, the way that they've described they are feeling, as depression. It's just a label. It's just a term that is used to refer to a certain collection or pattern of experiences.
And also you speak in the book about the questionnaire that doctors use, which has been devised by Pfizer, the drug company, which assesses whether people are depressed or not.
Yes, so there's GPs sometimes use something called the PHQ, Patient Health Questionnaire, which has various questions about one's mood and was devised by Pfizer.
So after your book and study came out, the medical profession kind of fought back and said, oh, we didn't believe all that serotonin stuff. That's all old news. Doesn't matter anyway, because we know the drugs do work. It doesn't really matter how they work. What was your reaction to that?
So it was a really fascinating reaction from the medical profession, which started off with this idea, it's not important, we knew that anyway. But at the same time as they were saying that, they were saying, but there is evidence of a serotonin imbalance. So that they were saying contradictory things. But the main point that was emphasized again and again was this idea that antidepressants work and it doesn't matter how they work. And I think both of those things are wrong. I don't think we have very good evidence that antidepressants work. And I think it certainly matters how they work, if they are having any effect. First of all, as to whether they work, there are many thousand placebo-controlled trials have been done comparing antidepressants and placebos, and they find a very small difference between using a sugar pill and using an antidepressant. A difference which is on an average of about 2 points on a 54-point scale, using the most commonly used depression rating scale. And that 2-point difference doesn't reach the criteria for being clinically significant or really making any difference to people's lives by all the common ways that is currently measured. And it is very likely to be explained by the fact that people can often detect whether or not they're getting the antidepressant or the placebo in these controlled trials. And so there is still some additional placebo effect going on in the people taking the antidepressants who are likely to be able to identify that they've got the real drug and therefore get more of a placebo effect than the people who are on the placebo. We can show that effect. We've shown that effect in various clinical trials, that what people think they're taking has really a very strong effect on their outcome, whether they think they're taking the drug or the placebo, regardless of what they actually are taking, has a strong impact on their outcome. So I suspect that antidepressants really have little effect or benefit in depression. But they are active drugs. They do change people's mental state in some ways. And one of the changes they produce is that they make people a bit emotionally numb. This is very consistently reported now. So they numb people's negative emotions, but they also numb people's positive emotions. And of course, that might also explain the very small difference between antidepressants and placebos in clinical trials. But that seems to me that taking a drug that makes you feel numb is a very different prospect from taking a drug that you believe is correcting an underlying chemical imbalance or some other sort of biological abnormality. Because taking a drug that makes you feel a bit numb highlights the fact that this is a drug that's changing your normal state of mind, and it's doing that by changing the normal state of your brain. Antidepressants are drugs that change our normal brain chemistry and thereby make us feel different. And if we're changing our normal brain chemistry, as we do when we have a drink of alcohol or take cannabis or heroin or any other sort of mind and brain altering drug, there can be negative consequences, particularly if we do it day in, day out, because we know that the brain gets used to the presence of a drug, that it adapts to accommodate the effects of a drug. And that's why, of course, people experience withdrawal symptoms when they try and stop the drug, because the brain has changed because of the presence of the drug. And not only that, but when you take a drug for a long period of time, repeatedly, sometimes it can cause damage. It can have harmful effects. It can interfere with the way the brain functions, with the brain's normal balance of chemicals and normal activity. So I think highlighting that antidepressants may work in this way should usually make people feel a lot more cautious about taking them.
What I'm curious about is that your colleagues had the same information, that they're no more effective than a placebo. So how come they came to a different conclusion?
The evidence that antidepressants are barely different from a placebo is not in dispute. That's been replicated by numerous meta-analyses. They often present the data in a slightly obscure way, so you have to delve into the detail to find that the actual results that were obtained were this small difference. They inflate it by categorizing responses and categorizing people's scores, and that can sometimes make it sound a bit better than it is. But no one disputes that the actual difference in the scores on these depression scales, which is the data that is collected from people, is very small. And yet, most psychiatrists seem to be very reluctant to admit or to acknowledge that this might mean that antidepressants are really not useful. I think there are two reasons for this. That depression is a biological condition and has a biological remedy is important for psychiatrists' views of their own status and their own role. Depression is the most common mental complaint, so psychiatrists want to believe that they have some special medical intervention that they can offer that is different from what can be offered by a therapist or social worker. I think another part of it is that now that we've told everyone to go and see their doctor when they're unhappy or distressed, doctors feel that they've got to have something medical to offer people. They're not necessarily the best people to try and sort out your marital problems or your debt problems, but what they do have is they can give you a prescription for a pill. And when you're confronted with someone who's very distressed, it is quite difficult to do nothing.
And so what do you tell your patients?
So I try and unpick what the causes are and how people might be able to address the causes of their low mood, and then direct people to services that might be helpful for that. I explain what I think antidepressants are doing. I explain that the evidence that they have any beneficial effect is not very strong, that it's likely that their effects are explained by amplified placebo effects or emotional numbing effects, that they are drugs that change normal brain chemistry and we don't understand enough about the long-term consequences of taking them. And then I let people make their own decision. As long as people are properly informed, I would then help people to choose an antidepressant that I think is least harmful and least likely to cause withdrawal symptoms and things like that.
And it's something you bring attention to in your book, that it's only now that these quite horrific withdrawal effects are manifesting themselves.
Do you know what, Katinka? Without the internet, I don't know that we'd really even be aware of some of the problems that are coming out about antidepressants now. Without the internet that's brought people together and enabled people to say, oh, yeah, actually, I'm having this problem, I don't know that we'd be aware of them, particularly these long-term withdrawal problems and the persistent sexual dysfunction that some people experience. I think this is a really important issue, and I do highlight it. I have to say that some people, most people probably who come to me, choose to take antidepressants anyway. And I think that's partly because they're just so commonly used that even though I'm saying this, people assume that they must be okay. And also, I suppose people often come to me or go to their GP in a state of desperation when they're at their lowest point. Maybe people then reflect afterwards, even though they think they need to go out with something there and then, maybe they reflect afterwards that it's not actually what they need.
And so can you tell us about the withdrawal effects that we're seeing now? Because I think there's this perception, isn't there, that you might have a headache for a few weeks. Can you tell me what the reality is, what it is because you run a clinic now, don't you? What are you seeing in your clinic?
Dr. Horowitz and I did a survey of people who were attending a primary care therapy service in northeast London. And we found that a high proportion of people, around about 20% overall, but actually if you looked at longer term users, it was more like 40% or more, could not manage to stop their antidepressant. That's the first really important thing to say, is I think a lot of people try and stop, and then actually the process is just too difficult and they go back on. And that's it. They don't register as a statistic. And they're probably told that they're having a relapse of their depression or anxiety. And so they need to go back on their medication and stay on it. Some people, and I think particularly people who've been using antidepressants for shorter periods, will not have too bad a time coming off them. They may experience some dizziness, a bit of brain fog and discomfort and some trouble sleeping and anxiety. And people often become quite tearful, very emotional. But for some people, especially people who've been taking antidepressants for longer periods, and especially people taking some antidepressants that seem to be much more difficult to get off than others, namely venlafaxine and paroxetine, people will experience these symptoms at a very high level. They'll really be severe and impairing. At their worst, they stop people going to work, they stop people going out, people can't think clearly, can't function very well. Sometimes they're bedridden, have to stop work, it can lead to relationship breakdowns. And people can be in that state for, particularly if they've come off their antidepressants really suddenly or too quickly, can be in that state for months and sometimes even for years. So antidepressant withdrawal really can be very damaging sometimes. And the process of trying to get off antidepressants to avoid those catastrophic consequences can also be difficult and very slow. So people have to reduce very gradually. And even then, people will find it to be difficult and still experience symptoms from time to time.
So there are over 8.5 million people in the UK on antidepressants. Do you have any idea how many people have these severe withdrawal reactions? How many people are being affected by this? Is it in the thousands or the millions?
I wouldn't want to put a number on it because that's as a proportion of the people who are actually coming off, and I've no idea how many that is across the country.
I suppose some people would just say, so what if they go back on the medication? What's wrong with that?
What's wrong with that is that antidepressants do have adverse effects and harmful effects on one's health, especially when they're used for long periods of time. So there's this emotional blunting effect that many people find to be unpleasant. There's sexual dysfunction, which is well recognized while people are taking the antidepressant. Taking antidepressants seems to increase the risk of having falls and fractures in older people. SSRIs in particular cause bleeding, so there's an increased risk of hemorrhage. There are risks to unborn babies if people are taking antidepressants when they're pregnant, and a proportion of babies, I don't think I can give you a specific figure, but I mean, it's more than 10%, I believe, maybe about a third again, experience of babies who are born to mothers who are taking antidepressants will experience a withdrawal syndrome after birth. There's also some evidence that antidepressants may be associated with increased heart problems and possibly with cognitive decline. So there are all these adverse effects that are linked with taking them.
I guess because your brain and your body, they become accustomed to these drugs, don't they?
Yes, we just don't know what they're doing exactly, but they are a foreign chemical that we are taking into the brain on a repeated basis, and that can have, untoward consequences.
So if antidepressants aren't the answer to depression, what is?
I think it's important to get away from this idea that we need a single treatment for depression. The first question to ask is, why is this person depressed? And looking at the reasons for someone's depression will lead in a different direction for each individual. The solution for each individual is going to be different depending on their circumstances and what they are responding to. Secondly, there are some things that people can do that are generally good for their moods, like taking exercise, mindfulness, meditation and relaxation have been shown to be good. Some therapy is also useful for some people, particularly maybe if people are not quite sure why they're depressed and need to explore the reasons why they might be depressed or they might need to address and look at. And then also sensible things like eating a balanced diet are probably helpful as well.
Do you think there's something a bit disempowering about telling people that they've got a condition, they've got this defective brain?
Absolutely profoundly disempowering. I think it's profoundly disempowering to say to someone, this is a brain condition and you need to take this to treat it. And that's been shown in research. If you tell people they've got a chemical imbalance, then they are more likely to think that they will be unhappy forever and less likely to think that there's anything they can do about it. So it definitely affects people's mindset, people's outlook, and potentially discourages people from doing the sort of things that they need to do to feel better, and making the sort of changes that might need to be made in their lives. People have said this to me, that when they start taking antidepressants, they might initially think that they have a chemical imbalance and they've been given antidepressants. They might initially feel a sense of relief and feel, oh, thank goodness, there's an explanation for this. There's a simple explanation and I just need to take this pill and I'm going to feel better. So initially, it might make people feel a bit better. But then if they don't continue to feel better, if they start feeling worse again, then they feel that they're a failure, that not only have they got a brain disease, a brain condition, but the treatment that's been offered to them isn't working. So what on earth can they do now? It can really contribute to people feeling even more depressed and even more demoralized and disempowered, as you say.
You must find that particularly distressing with the amount of adolescents that are being prescribed antidepressants.
Yes, if you're giving them out to younger people when they're still developing their sense of self and you're giving them a message that this self that they are becoming is prone to uncontrollable bouts of emotion, then you're potentially stymieing their normal development, the normal way that adolescents do manage to, by some mysterious process, get to grips with those uncontrollable emotions that one experiences at that age.
So what they're not being told is that they're playing Russian roulette with their sex drive because they don't know whether they're going to be one of the unlucky ones.
They have this emotion numbing effect, but they also seem to reduce sensitivity in general, including genital sensitivity and sexual desire. But it's recently emerged that for some people, those effects will persist after they stop taking the drug. We don't know how this happens. I think this is a good indication that we just really don't understand the consequences of taking chemicals that interfere with normal brain activity, and that it can have all sorts of unpredictable effects. But it's now very consistently reported by patients who've been taking SSRIs and particularly, but some other antidepressants too, and then stopped them. But it's also shown in animal studies. There are animal studies that show that animals that have been given antidepressants for a period and then taken off them show reduced sexual interest and activity.
There's just one Reddit group that has 16,000 members of people who have post-SSRI sexual dysfunction. So it's not that rare, is it, Joanne?
Even if it's uncommon, so many people are taking antidepressants, it's still going to be a large number of people. And the evidence that we have suggests it's probably not vanishingly rare, at least. I hope that we will reflect back that doing that, and particularly doing that with chemicals that we're not familiar with, is a very hazardous process. And I hope we'll use antidepressants as a wake-up call to really reinforce the idea that actually there are better ways of managing unwanted or chaotic emotions than suppressing them with various chemicals.
Do you think we'll look back at antidepressant prescribing and see this as similar to the opioid epidemic?
Certainly the marketing of antidepressants and the promotion of the idea that depression is due to a chemical imbalance has a lot of commonalities with the opioid story. In that case, people were told that OxyContin was a non-addictive opioid and that if people were in pain, they wouldn't get addicted. That was not true and turned out to be based on almost no evidence. And in the same way, people were told that depression is caused by a serotonin deficiency and SSRIs can put that. So I think there are lots of commonalities. And I hope that we will rein in prescribing in the same way that opioid prescribing has been reined in to some extent. Particularly in the United States, there were big campaigns to reduce the levels of prescribing of opioids from very high levels, though, of course. But I do worry that the medical profession, particularly psychiatrists, are just so wedded to the idea of having a chemical treatment for depression that maybe antidepressants will be here for a bit longer.
It's interesting, isn't it, how the right-wing press have supported your book, and also how the Trump administration is now looking at the threat of SSRI antidepressants. And so what do you make of that?
So I write about this in the book because it was a surprise to me when our paper came out how the different ends of the political spectrum responded to it. I grew up with it being the left who generally challenged the pharmaceutical industry. I think it's driven partly by good intentions, by the left wanting to destigmatize mental health problems and not to offend people who are taking mental health treatments. But I think it's problematic because I think that means that people are that the left-wing media is not informing its readership correctly about the hazards of taking antidepressants and about the fact that there are other ways of thinking about mental health problems, that you don't have to just see them as a disease, as a biological condition with requiring a medical intervention.
You must also get people saying, oh, antidepressants saved my life. What do you say to that?
lots of times, and people saying that antidepressants have been effective. And that's when I think we just need to come back to the research and show that there just is not evidence that they are very effective. And there is no evidence that they save people's lives. The evidence on suicide suggests that actually antidepressants increase the risk of suicidal thoughts and suicidal behaviours in young people. I wouldn't say that's a very common effect, but the evidence does suggest that the risk of suicidal thoughts and behaviours is higher in young people taking antidepressants than young people who are not taking antidepressants. And there's no evidence from randomised controlled trials that they reduce rates of suicide or suicide attempts or anything like that. And of course, people often think they're effective because they will go to their doctor and receive a prescription at their lowest point. And also, when someone goes to the doctor, it's often a crisis, and therefore people in their lives rally round to support them. So I think the point at which people receive antidepressants is often also coincides with people starting to make other changes in their lives, which can be helpful. So I think that's also why antidepressants are sometimes perceived to be useful. But what's curious to me is you most often hear that from people who are still taking antidepressants and often have taken several different antidepressants and had therapy and are still depressed. I suppose people feel that they would be worse if they didn't take the antidepressants, but I don't know how they know that. It doesn't always seem clear that they're necessarily doing so very well.
I suppose even if people do feel better initially, it's not a long-term solution, is it? Because I do hear reports of people who seem to react quite well initially. They may even feel euphoric, but that's not really a long-term solution, is it? Because the drug will wear off.
There may be some people who find the emotional numbing effects of antidepressants useful. The research doesn't really seem to confirm that they are very useful. But in theory, emotional numbing effects may take the edge off extreme feelings and be helpful for people. But as you say, that's not a long-term solution. And in the long term, it's like suppressing your feelings is likely to do more harm than good, because actually you need to find other ways to manage your feelings. And just suppressing them with a drug may well hinder you from doing that.
So what would you say to a family member or a friend who is depressed and wanted to take antidepressants?
I would just want them to be informed. I don't feel it's my place to tell them what to do, but I would want them to be informed about the randomised control trial evidence between antidepressants and placebo, of the significant harmful effects such as sexual dysfunction, and particularly about the difficulties of withdrawal and persistent dysfunction, which are probably more likely if people taking them for long periods of time. So I always say to people to try not to be on them, to try to get off them as soon as possible, to use them for the shortest possible time that they feel that they can manage, because problems with withdrawal and probably persistent sexual dysfunction are likely to be worse if people have been using them for long periods of time. So people can reduce their risks by using them, just keeping it to a few weeks or at most a couple of months.
Thank you so much, Joanna. And a reminder that Joanna's new book, Chemically Imbalanced, is available on Amazon and in bookstores. So that's all from me, Katinka Blackford Newman, mental health, fitness, life coach, author, health journalist, founder of antidepressantrisks.org. And if you wish to contact me, you can do so at www.kbnlifecoaching.co.uk. Thank you very much. And thank you, Joanna.
Thank you, Katinka.